it is. I'm going to talk about Pharmacist Liability Claim Report Second Edition, which is all the things pharmacists screwed up and killed people, not killed, but maybe injured people with for the last 5 years from 2013 to 2018. I love that picture. She looks so happy. That pharmacist looks so professional, but they don't show you that she goes home, takes the wrong drug, and dies. So anyways, this is the report about the mistakes pharmacists have made, and unfortunately that does happen. Why am I talking to you about this? Because I just got this the other day, and I thought this was a little interesting graphic here. Let me zoom in. Because we just talked about it in errors and omissions, right? So top 3 allegations by severity. So this is put out by the insurance companies, right? These are all the claims that they had to pay out on for pharmacist negligence or mistakes and errors, all right? So what are the most common things? If you look on the right-hand side, it's still the wrong drug and the wrong dose. 75% of the suits all have to do with you still just misfilling things for whatever reason, all right? But if you go down not too far, it goes through compound calculation and or preparation error. Is that percent in the gray bar going down to the red bar or getting bigger? Getting big, not a ton, but it's not going away, would you agree? So from 2013 to 2018, the compounding errors are not diminishing. They're actually going up there a little bit. And more importantly, when there is a compounding error, it's the second most highest damage award. So you realize it's not the most common, but the mistakes that are made due to compounding can be significant and have led to a lot of damage awards. So I thought this was a little interesting. It says compounding calculation errors account for 5% of the total claims, with an average of 324, which is more than 2.5 times the overall average. So again, when you do screw up on a compounding thing, it tends to be kind of an expensive problem. So the 2 examples they give is a TPN calculation, certainly more of an IV admixture calculation. So this isn't exclusive of sterile compounding. I know we're doing non-sterile compounding, but the last one is kind of close to what we're talking about with capsules here. I think this was an extended release tablet, but regardless, it's not a huge error in terms of calculations. Instead of 10 micrograms, they ended up with what? 10 milligrams of thyroid. Micrograms to milligrams, how many fold is that? 1,000-fold of thyroid, would you agree? And it was certainly practically, I don't know if it was fatal or a significant problem, right? MI. So, I'm not trying to scare you here a little bit, but this is important. And none of this stuff, and you're going to see the calculations today, I think are easy. But you have to be precise. And I would still say on the test, double check your own work if you can. And certainly on the errors and omissions, that's your job, is to catch other people's compounding errors. And it's a significant part, it's still an important part to our profession. So anyways, I just thought I'd show you that. Now let's talk about capsules, man. So last week was powders. Where did we stick the powders last week? On the skin, external, topical. Well, maybe it would have been the blue trash can at some point, but it was intended to be applied topically to the skin. What are capsules? Capsules are simply powders, like we did last week, but intended for what use? Internal use. And the nice, convenient way to package the right amount of powder, and so it doesn't taste all gross and nasty, is to stick it in a hard shell gelatin capsule. That's what you're making today, are hard shell gelatin capsules. Most of the capsules you count at work are hard shell gelatin capsules. Are there some soft shell ones? What do we mean by soft shell? Benzonatate, good, because instead of powder inside of there, we're talking about putting powders in a capsule. Can you put liquids? Docusate, nifedipine, there are other examples as well of a capsule, softer shell, not the hard shell, but where they'll put liquids in there. But then benzonatate is a good example of that as well. So we're not going to mess with those. Those are certainly more complicated and difficult to make. We're going to focus on the hard shell gelatin capsules with powder inside of them. All right, so compounding goals. What are we going to make sure? To make sure you get a good grade on your product, I'll still say calculations are huge here, because for most active ingredients, now we're not talking about topical stuff. Why would you make a capsule? Because it doesn't come in a commercial strength that you need. Or you want to combine 2 different drugs together in a unique combination. So there's different reasons, but usually you're using the normal type of therapeutic agents you dispense normally. Are there some drugs that are dosed in just 1 milligram or 2.5 milligrams or 5 milligrams? That's a little bit of active ingredient. Would you agree? If you don't mix things well, we're talking about the geometric dilution and everything else. If it's not evenly mixed, then if you made a batch, you might have a capsule that has 1 milligram and the next capsule might have 20 milligrams. Would you agree from a therapeutic standpoint for certain drugs, that could be really, really bad? It's important that every capsule has the same amount of drug in it. So we're going to want to make sure that our calculations are right to begin with, and then that kind of goes down to the homogeneous blending. We got to make sure that that drug is evenly dispersed so that each capsule has the same amount of drug in it. All right? Enough said, that's the powder. About the capsule itself, you know, they come in different colors. We're going to be using clear so we can see the powder inside there. So yes, there's color choice. What else can you choose about the gelatin capsule? Can you choose the size? All right, so right now, if I was to give you a happy pill, because some of you could use that. So if I give you a happy pill, would you want that pill to be in a size 5 capsule or a size 000? If it's happy, you're thinking more the better. But the problem is, if I give you the 000, you know, the reason you're not going to be happy is this: you're going to go because you can't swallow it because the 000 is not even intended for human use. They're not that big, but who are the 000s intended for if they're not for humans? Animals, horses. I mean, so the truly veterinarian applications for some of those capsule sizes, that'd be a huge mistake. So remember, the larger the number, the capsule, the smaller. I didn't invent it. It's stupid. Help me with all that. So why don't we, did anyone, some of you listen to the video, so for you guys in lab, and I'll say it here in a second, what 2 sizes are going to hold you responsible for? The most commonly compounded are size 2 and 3. Why not 5? 5 is a little bitty. Can you imagine trying to punch and the little bit of powder in there, you have no room for error. It's almost impossible to get to the correct weight. They're so small to handle physically. So from a human standpoint, making it, those aren't super practical. So size 2 and 3 are usually enough. Size 3s do better for children. Size 2s are better for adults in general from a size standpoint. All right. Now, can we have a capsule that just got a little bit of powder in it? No, we're going to have to make sure that they are what we call essentially packed. They have to be slightly packed, not loosely packed, not tightly packed, but enough powder in there that the powder doesn't slosh around and it's kind of packed into the capsule. Therein lies a lot of the calculations we're going to have to do, is to make sure there's enough powder in there to fill the capsule appropriately. And lastly, I love this dosage form, because you know the calculations aren't hard. It's you, mano a mano, 180-pound adult, against a 60-milligram capsule. Who will win? It's sometimes the capsule. I'm telling you, because all you got to do is punch, and get the right amount of powder in there. But you've only got 10 milligrams of error allowable. So too heavy, too light, too heavy, too light, too light. You know, you get a little frustrated over time, and by the time you've punched it 5th time, it's all smushy and it's all bent, and you're kind of sweating even if you got the gloves on there. It's nasty. What do you need to do? Dump it out and start over again. So appearance is important. We do want a nice polished capsule in the end so that it looks aesthetically appealing. So that is the challenge, is to get it to the right weight. So we'll see who wins. You will definitely see this. We talked about 10% excess last week for powders. Same thing happens here. And it's amazing, even if you guys don't see it. Because you're punching, some of the powder sticks to your gloves, some of it gets on the weigh boat, it just disappears. If you calculate for the exact number of capsules that you need to dispense, you will run out of powder, 2 capsules into it, or with 2 left to go. So to make sure that you have enough powder, we want you to base all of your calculations today and next week on the exam for 4 extra. From our experience, if you calculate for 4 extra, most of you should be able to have no problem getting the amount to dispense. Okay? USP 795 says 2 extra, because if you're a good compounder, you might get away with that, but trust me, you guys are going to do it for 4. And that's not mean or anything. You just want to make sure you have enough powder to have it. So 4 is a good number for you guys to use on that. So don't forget about that when we do our calculations. All right, we said the most common capsules are size 2 and size 3, and that they have to be loosely packed. We want enough powder in there, or at least slightly packed, so that it fills it up. However, how do you dose a capsule? It's on the active weight of the ingredient, right? But do you know how you fill a capsule? By volume. They are filled by volume, right? That size capsule has a certain volume. The larger the capsule, the more volume space in that. So would you agree, since it's a fixed volume, different powders will have different densities. Therefore, the same volume will have different weights. So you need to kind of account for that, because when we talk about, in this table, about how much powder it takes to optimally fill a capsule, the weight of that powder will differ because of the density of the different substances. What powder are we going to use as our diluent? We're going to mix our drugs. You could use any of the ones on this table. I'm showing we're going to use lactose. Do you see where I bolded lactose? Just so you know where this number I'm going to tell you have to memorize comes from. Why do we choose? Anyone know why lactose is kind of a really good drug to use for making capsules? It's compressible. Point is, and you'll see this today, and Judy will come up here and she's going to gather her powder together, and then she's going to mash it down. And when she mashes it down, it stays down. It compresses down. That compression allows it to stick in the capsule as you're punching it. If it was really loose, kind of like the talc was, do you know what happens when you punch down and you pull up? it all falls back out again. So you want a kind of a sticky powder. You want the compressible powder that will stay in the capsule as you go to fill it. So lactose is ideal for that property. Certainly there are alternatives. There are some people lactose intolerant. Now there's not a lot of lactose in here, but it could be a problem for some people. So in those cases, we would have to use a different powder. So it's not like the only thing you ever use is lactose. It's just kind of our go-to powder if we can. All right. Since I said you're going to use a size 2 and size 3, you have to go from the maximum capacity, and I'll just use size 3 for an example. The most you could possibly stuff in a size 3 is 280 milligrams of lactose. 75% of that is the least you would want to use, and that's 210. So you truly could formulate your size 3 capsules anywhere from 210 up to 280. Okay, there's no right and there's no wrong. But to go all the way up to 280 is impossible to get enough powder in there. And to be down at 210, it's getting a little on the loose side. So let's choose something in the middle. Let's choose something that's easy to remember and won't mess up our calculations. What do I want you to memorize? And I'm telling you, I won't remind you of this on the test, but I want you, if you have a size 3 capsule for either the errors and omissions or the actual wet lab part, your target weight for a size 3 capsule is 250 milligrams. All right, to spare you the long thing, for a size 2, which you're doing today over in the wet lab, so your lab today, you're going to use a size 2. When you do your calculations, you should base your target weight for each individual capsule to weigh how much? 300. And that you got to remember. Size 2 is 300, size 3 is 250. Just memorize that. My gosh, the stuff you guys memorize, you can handle that. Okay? Anywhere that. And that's where it comes from, and there we go. Let's just keep going. You ready? Let's do the dry lab. That's enough of an intro. Hopefully you guys watch the podcast, so let's do this. Turn to your copy there. I will tell you, do you really even need to pay attention to the dry lab? A, yes, it's fascinating. And B, did the dry lab last time kind of end up on the errors and omissions? Okay, so remember, I've got the dry lab and the wet lab to use when I make up my exams. So keep in mind, it's worth kind of following along and keeping track of all this stuff. So let's read and interpret this prescription here. So we have Bob Sykes needs some indomethacin, 12.5 milligrams. It says to make and manufacture capsules, dispense number 6, take 1 capsule every morning with food. All right. So go ahead and fill this formulation record out. Like I said, for completeness, I want you to kind of fill that out. I will never make you look it up on the test. As you're doing that, though, clearly indomethacin is the active ingredient. Is this a reasonable product to make? I thought indomethacin already came commercially available. Don't they make indomethacin capsules? You should never compound something that is commercially available, right? What strengths does it come in? 25 and I think 50, right? Does it come in 12.5? Can you take half a capsule? Could you take half a tablet? Yeah, if they came in 25 milligram tablets, I would dispense the real tablets and tell them to take half a tablet. But since they only come in capsules, then there's no way to break a capsule in half. But is that dose even reasonable? What kind of drug is an NSAID? Oh, I should have lowered. I just said it. Indomethacin, right, is an NSAID, anti-inflammatory. This patient, I know you can't see the profile, but is elderly, is above 60 years of age. What is the one side effect we'd be worried about using too much NSAID in an elderly patient about? GI bleed, renal issues. Would you agree? We certainly don't want to overdose and give them more NSAID than they need. So it seems reasonable for a vulnerable patient to give them a lower dose of an NSAID. So it seems reasonable since it's not commercially available. So go ahead and let's make a unique dose that'll help this patient. That's what pharmacists are for. That's what we compound for, is to make something a patient needs that's not commercially available. So let's make some 12.5 milligram capsules. All right. So this is important. Look over under the additional information. I'm telling you today, there are some things I won't put on the exam. I will not remind you on the exam next week to make 4 extra. But clearly, we're going to base our calculations on 4 extra. I want you to base yours on 4 extra next week, but I won't remind you to do that. Our source of active ingredient will become important here in a minute. We're going to use our 50 milligram capsules as our source of indomethacin. Why does that make this a little more difficult? Do you know what would have been really convenient is if we had indomethacin what? Bulk powder. If I had bulk powder, I could just weigh the amount of indomethacin I need, but that's not the case. I'm going to be using my 50 milligram capsules. And if the capsules you make are not pure indomethacin, what does that say about the capsules you're using for your source of active ingredient? They're not pure indomethacin, so we're going to have to take that into account for this calculations. All right. Green food coloring. Why green food coloring? Do you have to make your final capsule a pretty color? No. Why are we doing it? To visualize the mixing. What did we say when we have a little bit of indomethacin compared to a lot of lactose? We want to make sure it is homogeneously mixed. It's very important, and color change is the easiest way to make sure that that's done. So we're going to want to make sure we can visualize the geometric dilution. And then lastly, will the doctor normally ever specify what capsule size to use or what target weight to use within that? No, it's your choice. That is kind of the art to compounding. So you have to look at the patient's age and their issues with that. And again, for size 2 or size 3, those are the most common. In this case, we're going to base all our calculations here on a size 3 capsule. We're going to choose size 3. What did we say the target weight I want you to memorize for that is? 250. Will I remind that for the test next week? No. So here's the deal. The test next week, if I set out both size capsules, you choose and make sure that you use the right one. If I only set out one size capsule, whatever it's a 2 or a 3, you got to use what the appropriate weight is. So just make sure of that. All right. We'll come back to the little triangle-y thing here in a minute. We'll talk about that later. So let's turn and look at the compounding record. This is an important difference. It's a little different here, and Judy is going to want it on the exam this way. She told me to make sure that we emphasize the way this is documented. All right. Let's just say here, and this is not the right number yet, but let's say we need to use 7 of these indomethacin 50 milligram capsules. Well, we don't need all of that powder, right? That is the calculated capsule total is more than the amount that I need. But I need 7 capsules to get the amount. So in this case, you would document how many capsules you use, but you're going to then on the second line down, do you see where it says indomethacin capsule powder? That's where you will document the actual amount of powder you need and the actual amount of powder you weigh out, all right? But didn't we go from the supply station and use X number of capsules to get that powder? So the top line says how many capsules did you have to use? The line below that is how much powder did you need and actually get from those capsules. So you'll see that here in a minute when Judy goes through the procedure, but that's an important way to kind of look at that. And then you can see our other ingredients are going to be the lactose, the diluent we need, our food color, and capsules. And I will remind you on this, it happens every year, so let's talk about our beyond use dates, look at the expiration dates. Could we base our beyond use date on the green food coloring? Yes. Anything in there, whether it's an active or a formulation ingredient, could be the source of our expiration date, if you will. What about the gelatin capsules themselves? Do they have expiration dates? They do. You'll see that in a little bit. You're going to go over there and get them right out of the bag from PCCA. They're labeled. They have a beyond use date as well. So again, any part of the formulation can serve. So looking at those, go ahead and circle the one with the shortest beyond use date. So which one expires the soonest out of all of this? What ingredients does it look like this bad boy right there? Oh, that's a big circle. Okay, anyways. All right, so how many months is that from now? A lot. Would you agree that's more than 12 months from now? So what beyond use date should we put on our prescription? Go ahead and fill out the beyond use date. Yeah, am I doing something weird?
Ours has 2020.
Dude, okay, so I like that. I can deal with that. What the heck did I do there? So does it still say May? Okay, May of 2020. So, oh good, that's a little closer, right? How many months is that from now? 3, right? So we're going to use 3 months, not 6 months. What is 3 plus 2? Right? No, wait a minute. We're not adding it to today's date. But wait a minute. Today is what day? I'll say this. Today is the 13th, right? So are we going to expire this on May 13th of 2020? This was a real source of problems on the errors and omissions in general. Not maybe in this group, but I'll just remember, if we were doing it 6 months from today, then what would be 6 months from today? 8/22 of 2020, right? 6 months from today is 8/22 of 2020. But in this case, it's not 6 months, it's what? It's the end of May. So what is the end of May? 5/31 of 2020. So the beyond use date of this should be 5/31 of 2020. Are we okay? Now looking like I've gone off into some pasture here, or I'm still okay? Don't know what happened to my thing here, so I apologize for that. Okay? Well, let's move on. Let's do calculations. See if I can not screw that part up. All right? So I like this required amount of indomethacin. Okay? How much indomethacin per capsule do we need? 12.5 milligrams per cap times how many capsules are we dispensing? Ooh, there's a little tricky terminology there, right? How many capsules are we dispensing? 6. How many we're going to base our calculations on? 4 extra would be 6 plus 4 is 10. So let's multiply that by 10 caps. So 12.5 times 10 is 125 milligrams of capital I will stand for indomethacin. Just so you realize here, all of my units, I think, for these calculations are in milligrams, just to be consistent with our units here. Okay? Now, this may be somewhat intuitive, but let me calculate it. How many capsules? What capsule size did we say we're going to use? Indomethacin, what strength? 50 milligram capsules. So if I need 125 milligrams, and I'm using 50 milligram capsules, how many do I need? 0.5, which means I really need to use how many? 3 caps. We would need to go over there, and this is what I'm getting at. We need to use 3 capsules, right? But do we need all of the powder from those 3 capsules? No. So let's go back, just go to your compounding record real quick, and let's fill this part out. We already know that my target amount and my actual amount for the capsules are 3. Judy is going to have to pull 3 capsules to use this, but that's not still going to be the right amount of powder. So the next step says to go ahead and weigh the contents of the required number of capsules. So let's make it.
All right, so we don't want the weight of the weigh boat. Let's tear that. And also don't forget that we are measuring the content. That up.
What could possibly go wrong even in this step is weighing the 3 capsules with the shells on it. Okay? So remember, we want the contents of 3 capsules that contain the 50 milligrams each of indomethacin, not to include the capsule shell.
Okay, so everyone, when you open up, make sure that there's nothing left in there. We taught you the trick how to open capsules already, so I'm not repeating over here.
And you get to do it today. One of your active ingredients is coming from a capsule. So remember, when you do the same exact procedure, to open them up carefully over a weigh boat so you can get an accurate weight. Let's go with 1.187. 1.187 grams, which is 1,187 milligrams. So 1,187 milligrams. Okay. Is everything okay so far? Take a deep breath. How much indomethacin do I want? 125 milligrams, right? But when I opened up the weigh boat on there, we just opened up 3 capsules, right? So how much indomethacin is in that weigh boat up there? 150 milligrams of indomethacin, and we know that 150 milligram weighs what? 1,187. So let's set up that proportion. So if I know I have 150 milligrams of I for indomethacin, and in that it weighs 1,187 milligrams. I'm going to put a capital P for powder. Okay, so I know I want 125 milligrams of indomethacin. I'm going to put that over X milligrams of powder. So let's each solve that, and I always have to do it as well since our numbers are always a little bit different. Let's figure out how many milligrams of powder we need to only provide us 125 milligrams of indomethacin. Rounding to the least amount that I can weigh, which is a milligram, did you get something like 989 milligrams? Judge me on this. Remember, I've already messed stuff up, but I think when I solve for X, that is 1187 times 125. Divide by 150. I got 989 milligrams of powder. Okay? Okay, that's an important calculation. You're doing that twice today out there. Just realize, should both of your active ingredients come from a commercial source, a tablet or a capsule, you're going to have to do this same calculation to some extent. So make sure you're comfortable with that. Dude, well, there's the cap. All we got to do is weigh out the 987, and we have the right amount of indomethacin for how many capsules? For 10 capsules, right? So if I put 989 into 10 capsules, that would be about what? 99 milligrams per capsule. Do I need to add anything else? You're saying yes, but why? Because that's not enough powder to put into a size 3 capsule. What did we say the least was? Was like 210, right? And our target's 250, I'll say. So I'm just trying to visualize. I'm not doing it well. Would you agree that this amount of powder for the 10 capsules that we need is not enough powder to fill the capsules appropriately? So the break in your calculations now is let's not worry about the indomethacin. Let's focus on the capsule, and we have to make a choice. What size? It says size 3 is our choice, so we had to make that choice, size 3. What did the selected target weight for us is going to be? 250 milligrams. That's a choice in life, just like you chose to come here today. Well, not really, but anyway, so not a good example. So let's start with the choice of 250 milligrams per capsule. So if we have 250 milligrams per cap, times how many capsules are we formulating for? 10 caps. How much total powder would I need? If I'm going to just fill my capsules with powder and I've got 10 capsules at 250 milligrams each, would you agree I need 2,500 milligrams of powder total? I'm going to put the capital T. That's everything. Would you agree? If I've got 10 capsules and each capsule weighs 250, 10 of those means 2,500 milligrams total. What are the two things that are going to be in there? I've only got two things, right? An active ingredient indomethacin, and whatever's not indomethacin will be what? Lactose. So from the total, let's subtract the amount of indomethacin. I know how much indomethacin I need for 10 capsules. So from that, let's subtract the 989 milligrams of indomethacin. I get 1,511 milligrams of what? Lactose. So for the compounding record here, this is what you're going to want to write down for your target amounts. Our target amount of our indomethacin powder is 989 milligrams. To that, we're going to mix a total of 1,511 milligrams of lactose. When I mix those two weights together, what's my total weight? 2,500 milligrams, and that's enough powder to fill 10 capsules. All right. So, any questions? This is the little bit of, I say, a trick. Just remember, you're going to take the total number of capsules times their total weight to give you the total amount of powder. From that total amount of powder, you just subtract each ingredient that you have in your formulation, and what's left will be the bulk powder. So once again, before I put Judy up on the screen, let's make sure I fill this out. We said lactose target was 1,511 milligrams. And my indomethacin powder was 989 milligrams. Okay, so we'll need actuals for all of that. And turn to the procedures, and let me get her up on the screen. So, to do this stuff. Yes, please.
Whenever you go to grading the calculations, does it matter how we get?
No.
You can do like 2.5 capsules over.
That's a good question. I remember that's why we want you to write your calculations out in case we have a question, but I grade you on your final number. So you can approach this however you want. And I know sometimes I do it a long or maybe more extended way. You do not have to solve it my way, but just make sure you do get the right numbers. Okay, yeah, display.
Okay, I have my indomethacin final weigh boat over there being paired. What is my target weight for indomethacin? 9.
So you could either weigh out the 989, or you could have just weighed back out down to a 989. It really doesn't matter which way you do it, obviously. But let's see. You're going to want to document her actual. Is this our indomethacin?
Yeah.
I think our target was 989.
Oh, 989. Oh, okay.
And I talked so much, even Judy got bored.
Ooh, so close.
That's our secret. That's golden. Let's do 9. So you can do it in milligrams or grams, however, it doesn't matter. Just make sure you get the units right in the document. So let's do 0.991 grams or 991 milligrams. However you want to do it. Let's just do 991.
Okay, all right, set
milligrams.
this
And our
aside.
target then for lactose is going to be 1,511. 1.511.
1511.
We can step one where we are weighing out all of the individual ingredients.
Ooh.
Let's go for lactose, an actual of 1.522 grams. 1.522 grams or 1,522 milligrams, whichever you choose. So, now, before Judy goes on, let's do a couple of things here. So, before she does this, let's go to step number 3, circle the word geometrically. So step 3, geometrically, is very important. Step 4, this is super important, circle the word block and the word bed. These are ones we grade off for, so block into a powder bed, so block and bed. Step 5, circle the number 6, the target weight of 250, so 250 milligrams, and size 3, circle the 3. So the 6 and the 250 and the 3. That one step has 3 parts. You got to tell me how many capsules you punched, to what target weight, using a what size capsule. So there are 3 steps in all that. Step 6, circle the word polish. Okay, those are some key terms. Just as you're memorizing and creating your own procedures, those are some main things we're trying to look for. All right, going back to step 2, though, it says place the indomethacin capsule powder into the mortar, add 1 drop of green liquid food coloring, and triturate until uniform.
All right, so at this point, you know that it's the smaller amount need to go in first. In this case, will be indomethacin. All right, because we have 2 white powders, and for better visualization, I'm going to add 1 drop of green food color. Okay, let's triturate this one.
Oh, wait, do you see a little white spot there in the middle?
Uh,
So that's, I mean, that's the whole point is we want to make sure we get it all mixed in there.
I didn't see
Or is that
anything.
just a gap? Or is that just
It's gone.
yeah, beautiful. Okay.
All right, so technically I have definitely more here. So I need to do 2 addition. All right, and I just did a 1 addition. Did you see that? Okay, good. Thank you. Here comes the 2nd addition. All right.
Rachel Reed does this stuff all the time.
The goal of today is me not falling asleep over here, so. Oh, thank you.
There's a lot of empathy for you out there. There's a lot of empathy.
I am under a lot of medication, so. Not that kind of
Don't answer
medication.
that. We don't want to know anymore. Judy, we're losing the crowd here, man.
Oh, okay. All right. Even for me, I don't think I'm not quite there yet. So let's try one more time.
So that finishes up kind of step 3.
Okay. All right.
Now this isn't important as she brings this over here. This has to do with some equipment things that you're going to have to do. It's a little bit different for you guys.
Okay. So we need you need actually a piece of parchment paper or ointment paper. Okay. Now for me, because I have a piece of diaper underneath it, it's really soft. So I would have to use this. Do you guys know what this is? Ointment slab. Okay. You do have an ointment slab in your drawer as well, but you do not have to use it because your bench is hard enough. You could just tape a piece of parchment paper on your bench directly. Now when I say tape a piece of parchment paper directly on the bench, don't be lazy. Don't just tape 1 corner.
It sloshes around as you're trying to punch them.
Literally tape all 4 corners. As you do the procedure, you know what I'm talking about. Okay, so don't be lazy, please. Okay, all right, the next step is?
To place the mixture onto a ointment paper and block the mixture into a bed of powder. Using 2 what size? Does it say? See, it does say large metal spatulas. And Judy will explain why here in a second.
Okay, all right, you guys ready to eat some teriyaki? I I'm juggling some capsules. Janae, size 1. Larry, 000. Okay,
That would
all
shut me up
right.
for a while.
Okay, all right, so we're gonna block the powder. This is how we block the powder, okay? So using your 2 large spatula, okay, make a little square first, okay? All right, and set one down, and use the other one, literally, like you have to press down with your finger really hard. So press down really hard.
And then stop there real quick.
Oh.
Well, I was just going to show the difference. I mean, could you
Yeah.
see the difference in height? Lactose is a good powder because it compresses down. And this is an important step. You all kind of block it in really nice, but compressing it down is what's going to keep it in the capsule as you do the punching. So this is an important step.
Right, so you won't get this kind of feature if you're using other powders like the one you used last week. So lactose will give you that. All right, so that's the first step before you can actually.
So do you fill capsules? Do you place powder in capsules? You're going to learn the 3 Ps. Today, this is to help you remember, there are 3 Ps. Okay, it starts with punch, pinch, and polish. Write that down because that's a famous quote from me. Punch, pinch, and polish. Those are some key terms that you'll want to do here. This is the first one. Filling the capsule that she's going to show you here in a minute is punching. But well, let me finish that writing down. Now, watch this. This is the #1 cause of mistakes in compounding capsules.
Okay, all right. So the key thing is I want the weight of the powder, not the capsule shell, right? So pay attention to the weight of each capsule shell. If I place a size 3, usually it's about 45 milligram. If you're using size 2, usually it's about 60 milligram. Okay, so I don't want this weight. I want to tear with an empty shelf to start with. Okay,
What will this read when she removes the capsule?
a negative number.
Negative about 45 milligrams here. I'm just saying that when you guys get out there, you have to do that between every single capsule. Forgetting to do that in having a capsule that on my scale is 60 milligrams less than it was on your scale is because you forgot to tear with the empty capsule. And do it each time or somehow it gets messed up.
All right, so as Larry was talking to you, what I did is I tightened my glove. And this is the point that you really want to make sure that your glove is tightly squeezed into your fingers, okay? All right, so you guys know how to open this, right? They're not locked yet. It's for those empty shells. Open this, okay? We're using your body, not your body, but the capsule body, to do the punching, okay? So, all right, punch Larry, here comes, okay? So you want to scoop from the side, okay? Scoop in and turn really quick. All right, cannot do the slow-mo here, so it will be quick. All right, so that at some point I feel, maybe it's ready. I don't know. But how do I know? I can put the cap on.
How did you put the cap on?
Do not lock it, because you'll regret.
Unless you're really, really confident. You got a one-time shot on that. So let's do this quick now. So what was our target? Take the 250 times 0.95. On the test, each capsule, and today, to get out of lab, we are going to weigh each one of your capsules. You are graded on your worst capsule. So if 5 of them are great and you got 1 stinker, you lose all the points for the thing. We will base your grade only on your worst capsule. So she can be as low as what? And I'll even give you the half a milligram. Okay, so I'll go down to what, like 237 up to 63. Right? So somewhere within that range would be where you have to be. So is this a keeper?
No. Oh. Fine. All right. So we have to punch more, right? Okay. But this bed is not good anymore. So you have to remake your bed. All right. Gather your powders. Do you guys make a bed in the morning anymore? Okay. Me either. All right.
Cold medicine is.
I know, it's working really. Okay, all right. So press the powder again. Okay, all right. So the good news is I didn't lock my cap. All right, I can easily take apart. Okay, and I can flip. Now I want to punch really quick, and then hopefully this time I got enough. Please. Ooh.
So, now, this is really important on the QA section. So I said you're going to be graded on your worst capsule. You need to write down each individual capsule weight, but not yet. Okay, this I'm going to say here. But look at what it is. 244 now. We haven't done the other two P's, right? We've only done one P. What is our first P? Punch. We've now punched it. She's going to do the other two P's before we do our final QA weight for that capsule. So.
Okay, so here comes the second P because it's not locked yet. All right, so hopefully that you guys can see the difference. So you want to actually pinch down to the point that you feel the click. That means it's locked. Okay, so you will see a big difference in terms of length, but not over here, but when you actually do it, pay attention to the difference. Okay, all right, so here comes the second P, which is pinch. What is the third P, Larry?
Polish.
Polish, okay. What should you use for polish? This is a time. Don't use for your notes, by the way. Okay. I haven't used for my notes yet, so don't worry. So you want to polish really well, make it very clean from the exterior. All right. After polish, recheck your weight because you might have lost a couple milligrams there.
So this will be our final QA weight. So you can tell that we lost like a milligram at the most. So let's document this under QA. Go ahead and write down 243 milligrams. So you can do it in grams or milligrams. It keeps moving. Let's do 243. That's what it showed up as, 243 milligrams. Now, will I know which one of your capsules was 243? No, I'm never going to have to. You have to put capsule number 1. There's no way to identify that capsule, but you do want to write each individual capsule weight. All right. Now, because we're making how many capsules? 6. Well, we're dispensing 6 capsules, so we're going to write each individual capsules. Do some of you work in compounding pharmacies that make batches of 30 or 100 at a time? You can make these using those Janssen machines type of thing in larger batches, at which point they will calculate an average capsule weight. So there are ways when you do larger batches where you won't do each individual. But when you're doing smaller amounts for an individual patient, it's still common that expected that you will do that.
Okay, all right, so we just finished first one, but we have 5 to go. So as I do the second, third later on, guess what? This is about the amount of powder left. And I still have to punch one more. So this gets the tricky part because it's going to be really hard to do the punching. So here I'm going to introduce you the second method in addition to the punch.
So let me clarify that before she does. The punching method is where we want you to, what Judy just showed you. Remember going stand up and then up and down and up and down and up and down. That is the preferred method when you have a lot of powder. Why? Did she really have to polish a whole lot to get it clean? Because you're not dragging it through the powder. It keeps it clean, but it takes you to do it pretty quick and it takes a fair amount of powder to get it all packed in there. As Judy's saying here, when you get down to your last couple of capsules, you've lost a lot of that powder. Some of you won't be successful doing the punch method and you get kind of frustrated. So this is the alternative method that you can do. If you can never punch, go with this method. Preferably you can punch, but by the end it may be easier to get them heavy enough. If you're having a hard time getting your punched capsules heavy enough to the right weight, this method is a guaranteed method, if you do it right, to be able to get them to the final weight. So this is the alternative method.
Okay, so here comes the alternative again. Larry, do you want to show that? Yeah, make sure you tear your capsule shell. This is the most common mistake that students actually cry in the lab during the exam. It happens yearly to our students. Okay, because
and it's just embarrassing when the guys do.
Right, because because you don't lose a couple points, you lost every single points for a product. So that's why. Okay, all right. So we tear this, and I don't have a lot of powder at this point. Okay, so I'm going to gather my powder together, and I'm still going to make it a bit tight. All right, so I am going to place the cap on the side, okay, using one of my larger spatula to work as like a dam. So this is a dam method. Dam.
Best name ever.
All right, so you are going to actually punch against the rubber spatula. The difference here is, did you guys see it's all powdery everywhere on my fingers and on the capsule
It's
shell?
punching, but instead of punching up and down, it's punching what? Sideways, right? You're just kind of scooping the powder in and punching it, and you do have to press hard against that spatula. That still needs to be what presses or compresses the powder in, but because you're not fighting gravity at this point, you won't have it all falling out.
So it is a little dusty compared to the first method. Okay, so let's see, how did I do?
Wah.
Oh, okay, all right, that's not quite enough. All right, so let me open this up and do it again, okay? The less powder you have, the harder it gets. Okay, that's why you guys are making 4 extra calculation-wise. But even if, for me, when I work in the last one, I get frustrated as well. So what should I do?
Third method, desperation method.
Desperation method. Or cheating method. Okay, so how do I cheat? So let's say I do so many times and I'm just not getting enough. Okay, you can use your cap to scoop up a little powder, okay, and try to put them on. Oh, hopefully didn't lose a lot. Let's see.
Suspense.
Oh, wonderful. Okay.
Let's document this down for number 2.
Oh yeah, good catch. That's right. Okay.
Sadly, I'm not even
Thank
on
you.
medicine.
It's contagious. Okay, all right. So what am I doing? Pinch. Make sure you feel the click. Okay, it gets significantly shorter. You can easily tell. All right, and then what I'm doing right now, polish. Okay, especially the last 2 methods are very dusty, so you want to polish and then redouble check your weight.
Write this down, 246 milligrams. Now, and Judy showed you when you punch it, it came out low, and she repunched it or redid that as well. What happens if you punch it? Can it come up too high? It's the easier problem to handle, but when you take the cap off, just kind of squeeze the body just a little bit and transfer a little powder out. So do you see where it becomes just the U versus the capsule, doing it enough times to fill it? What I will tell you, it's kind of interesting. Most of you will really not have a problem, because it's interesting. I will tell you, just gather and block the powder and punch, and just keep punching. It's so hard to overfill these that it is better to have too much powder than too little. Punch. You feel the body get fat. It gets filled. As it pushes in, it kind of pushes out on the body of the capsule, and you can feel it get tight. When the capsule feels tight, that's a good time to go ahead and and turn it over and put the cap on. So 2 things though. What's wrong with punching like this? Gravity will suck it all out of there. So really, take some deep breath and feel the burn. Just getting your steps in. So you got to do it fast. It's kind of uncomfortably fast for some of you, all right? So the other thing I will tell you, as well as far as, what was I going to say? The other issue with that, is and you'll be so happy you'll turn it over. When you're fast, are you with me? So whatever it is, turn it over quick, because like that, it's falling out. So just remember, gravity's not your friend here from a procedural standpoint, all right? So we'll skip the rest of those. We're going to assume the rest of our capsules were perfectly right weight. So let me put this back on. And we will proceed on. All right, okay. So, any questions? Now, we'll see on step 6 where it says polish and transfer. It says a 6-gram prescription bottle. Even today, you're just going to put them into a medium weigh boat. You can document it on the test with a medium weigh boat, but normally you would obviously put these into a prescription bottle. Why? What are the 2 things about prescription bottles, even for capsules? What color are they? Amber, which is kind of light resistant. And then what kind of cap do they have on there? An airtight seal. I know it's child resistant, but then airtight. We'll talk about those. But anyways, all right, let's just get through this. So let's look at your QA. You would have written down each individual capsule weight. I will tell you for your own sanity, since when you do this for real on the test, you're going to be documenting each capsule weight. That's where I would write an acceptable range. Even before I do anything, I'd write, given whatever size. And today you're doing size 2, which are, what's target weight? 300, right? So I would calculate on my sheet the target weight, the range, acceptable range, before you start punching. That way when you go to the scale and look at that number, you know whether or not you're in there. So to that end, and I'll just use your numbers now. For 300, if you do the math, it's as low as 285 or as high as 315. On your wet lab here, it'll be 285 to 315. You're going to weigh it on your scale, but I'm going to grade it on what scale? Mine. Will they be exactly the same? No, but we don't have a lot of flexibility here. So I'm telling you now, from having done this for years, if you stick between 290 and 310 on your scale, that's usually safe enough that my weights won't be off, okay? So I'll give you 285 to 315, but if your QA is between 290 and 310, then the little bit of difference between our scales is probably not going to cause a problem, okay? I said, though, if even one of yours is out of range, you'll lose all of the points for the product. On the exam, we will go back to your scale, okay? Because I know there are some differences in scale, so on a high-stakes stuff, we would weigh your capsule again on your scale, but usually it's because of a tearing problem or something else. But anyways, there you have it. So that's the kind of the QA part. We got to describe those things. So the only part to describe is, let's describe the powder inside the capsule. What was the color of the powder we just did for your QA section? Green, light green. So I said light green powder. Contained in, we got to describe the capsule. What was the color of the capsule we used? The capsule wasn't green, the powder was green. What was the color? How do we describe the capsules we're using? Clear. They were clear size, in this case, what we're doing here, size 3 capsules. Okay? So the inspection was light green powder contained in a clear size 3 gelatin capsule. Since we just wrote that down there, let's go ahead and talk about, I can go a couple of different directions, this. This is the #1 documentation point that I will take off because it's this weird, unique thing for capsules. I didn't invent it. I don't know what the deal is. But on the face of the prescription for a compounded capsule, by convention, you draw a square, rhombus, what is it? A triangle. It's a triangle with what number on the inside? The number to dispense? Your phone number? The size of the capsule. What size did we use here? #3 capsules, so the triangle with the 3 in the middle is the size of the capsule, and below that, and again, it's not the color of the powder, it's the color of the capsule. So what capsule did we use? It's clear. So again, the triangle that indicates we used a clear size 3 capsule. Okay? So today on your wet lab, make sure you document that before you come over to check out. Yours will be slightly different, but make sure you do that same sort of documentation on that. Okay? So that was about the QA stuff. What else? Beyond use dating, we already talked about as far as the 6 months or shortest expiration date. Again, you got to always say whether to refrigerate or room temperature for storage. What is the storage for a capsule? Room temperature. So put room temperature down. Just like powders, please add airtight container or tight container. Is humidity a problem for gelatin capsules? It is. You live in Florida, and if you keep that thing exposed, that gelatin will suck a bunch of moisture out of the fluid, out of the air, and get all gummy. You live in Arizona, then that dry air sucks the moisture out of the gelatin because there's water in the gelatin, and it gets real brittle, and you go to pick it up, and it cracks and breaks and everything. So again, an airtight container is important for storage. All right, special documentation I went ahead and talked about. So drug labeling is the nice thing is it's not difficult. Drug name, strength, and dosage form. It's a capsule. For me, for a compounding, I would need you to put oral capsule. All right? Do you really put that at work for every normal capsule that you do? Call it an oral capsule. No, but for compounding, can you compound capsules to be used something other than orally? They can be used vaginally. There's kind of otic or ear ones. You can even use rectal capsules. So again, we want to be clear on where this capsule is supposed to be used, so we're going to call it an oral capsule. Beyond that, the drug names are pretty straightforward. Nice thing, auxiliary labels, there's no required auxiliary labels for a capsule or an oral capsule. Now, in real world, are there auxiliary labels for indomethacin? Yes, right, take with foods. But for me in the lab, I'm not grading on your patient counseling or drug-specific knowledge. So I encourage you to do those things, but for me, grading-wise, it's about the dosage form, and there's nothing for an oral capsule. Okay? Did we survive the dry lab? Okay, so let's look at your wet lab. You're going to do this. I'm not going to do the calculations for you, but let's look at it and make sure we know what you're going to do out there. Hopefully you watch the video on how to make it. What's kind of cool about this is you're making not only unique strengths for a patient, but a unique combination so that this child, Joel, who's a young person, not too young, but anyways, Joel needs essentially a combination of 5 milligrams of propranolol with 6.25 milligrams of hydrochlorothiazide. Combine that into a single capsule. You're going to have to dispense 6 capsules, and it's going to be used for a cardiology test. All right? Good enough. Now, on the right-hand side, I'm reminding you for today in lab to base your calculations on 4 extra. The only capsule size I set out for you today is a size 2 capsule. So you're going to have to base your formulation on the use of a size 2 capsule in an appropriate target weight. Again, I won't remind you to do that on the test. For me, you won't have to use additional food color because it turns out one of your drugs has a very nice bright yellow color. So your active ingredients have a color to begin with, so you'll be able to visualize the mixing with the lactose without any additional ingredients. So that's why your formulation doesn't need to have additional food color. Okay? All right, that's all I'm going to say about the calculations. So when you get out there, though, a couple of things. You're going to need to do. I have posted my keys in the same places by the supply stations. Do your calculations and check them against my key. There's a problem though. Part of what you're going to have to deal with is the fact that your active ingredients for propranolol are 10 milligram tablets. All right? Your active ingredient for hydrochlorothiazide, I think they're 50 milligram capsules. They're commercial tablets and capsules. So to calculate the amount of lactose, would you agree? You take the number of capsules times your target weight gives you the total, right? Aren't you going to have to subtract the weight of your active ingredients? Well, you have to keep in mind that there are going to be maybe a commercial, the tablets and capsules aren't pure drug, so you're going to have to get the actual products that you need, do the weights, set up the proportions, and do everything. Remember what we did up here for indomethacin? You have to do for the hydrochlorothiazide and the propranolol. Okay? Now, let me give you a hypothetical. Let's just say that the propranolol tablets ended up being an exact number. This is not the right number, but let's just say you needed 7 tablets, exactly. Let me ask you this, to weigh a tablet, do you have to crush it up first? Does a tablet weigh the same as a tablet as it does when it's all crushed up? Don't crush it up, man. You can't get it all out of the mortar. Just stick the tablets on the scale, all right? You don't need to crush them up before you get the weight of those tablets, okay? Can't you just stick the capsules on the scale then, too? No, because of the shell thing. So you do have to dump the powder out of the capsules, but you don't have to crush up the tablets, all right? Let's just say you need exactly 7 tablets. Do you even need the weight of those tablets then? Yes, because those tablets are not pure drugs, so you still need the weight of those tablets, even if it's an exact number, all right? So, hopefully you'll kind of see that and go down already. So, check the calculations. My key, again, our weights may not be exactly the same, because you do need to use the weights of your propranolol and your hydrochlorothiazide. They may not be exactly the same, but you should be able to see very similar numbers and see the process. Please ask Judy and I if you have any questions. These calculations aren't hard once you get it, but to get it, make sure you get it from us and make sure you know how to do it, all right? So then you're going to go ahead and make all of these things. Do fill out, there's a couple of things to fill out on the procedure as you go and do. You're going to make those capsules and all of that. To get out of lab today, though, I will tell you, you are going to bring over your completed sheet with all your documentation. It's all got to be documented. You're going to bring your medium weigh boat with your final 6 capsules. You know, on the test, the number 1 way to lose points as well, bring over 7 capsules. Because some of you will, don't you have enough for 4 extra capsules? Some of you just get real happy and you just start making capsules. Or you'll think maybe I'll have one in back just in case. Well, you can't. Whatever you bring over in a weigh boat is what you're dispensing to the patient. So remember, you can only dispense the amount that's been prescribed. So bring over your best capsules, pinched and polished and ready to go. Checkout may take us a little bit longer because we are going to weigh each of your capsules the same way we will do on the test. So we're going to kind of do a more minimal checkout with you. So we're going to ask, guess what we're going to look for? We're going to look for the triangle on the face of your script because some of you are going to forget that. I'm telling you that now. We're going to make sure there are 2 lines for each of your active ingredients. Why are there 2 lines for propranolol tablets? Because there may be the number of tablets and the amount of powder. Same thing for the hydrochlorothiazide, right? There's going to be X number of capsules and X amount of powder from those capsules. Remember the same format we had for the indomethacin, okay? We're going to look at your beyond use date just to make sure you got the right beyond use date, given all of your ingredients, and then we're going to weigh your stuff, okay? Meaning, if you have any other questions or want anything, you got to ask us, all right? Because we're going to try to get you through it. It'll take us a while to go through the capsule weighing because we want to make sure you get your capsule weight. That's the hardest part of today's lab. But if there's something else, grab it from us because we'll pretty much let you go after we've weighed your capsules and looked at those few things, all right? Judy, anything else you want me to say before we turn them loose? All right, so if you're one of the extra people, then just let everyone else go out there and get settled. I think you know where to go. You guys were sitting fine for the quizzes. Get out there and let's do it, man. Go out there. Don't forget gloves and everything else. And